Now, WFMY News 2 received a lot of messages about the protest, not only about the protest message itself, the violence at times and how police handled it, but also about the health issues with the protest, which is why we have Cone Health's Dr. Mary Jo Cagle, Chief Operating Officer, and Dr. Kevin Steinle, Medical Director for Cone Health Emergency Providers. All right, so we're going to take a couple of these questions here that we've received over the last couple of days. Dr. Cagle, some protesters were wearing masks, some weren't. There were many people on my Facebook page who are worried that the protests will spread the virus.
Yes, I think that's a very valid concern. As all of us were watching this unfold on the news this weekend, I was very concerned to see people shoulder to shoulder, hand to hand, in close proximity in big crowds, many without masks, all without gloves. And my thoughts were the risk that they chose to put themselves in. And of course, each individual has that right, but they put themselves at risk. And then I was also concerned that what risk were they putting their families at as they went back home to their families, or the risk they might be putting their colleagues at work at if they went back to work. So I think there is an increased risk of having the virus. Most of the folks protesting were young and healthy, and the most likely not to have symptoms from the virus should they get the virus. But not everyone in their family would have the same situation. So I'm concerned for family members that might be older that they come in contact with. And so from a public health concern, in 7 to 10 days, I'm concerned about our community seeing an increased spike of cases in our community.
So, Dr. Steinle, would you recommend then folks who are maybe at the protest quarantine themselves now?
I don't know that everyone that participated, in the protest would necessarily need to do a strict quarantine, but I think certainly they would, need to use those things, those tools that we've all learned to use. In other words, say you participate in an event. Yes, ideally, even in a protest, you would maintain some sense of social distancing. Ideally, you'd be wearing a mask. But if that doesn't happen and you did participate, I think maybe many of the same things that we do when we leave the hospital after taking care of COVID patients, could be employed. Simple things like avoiding touching your face, hands to face or nose, washing your hands or gelling your hands frequently. Immediately upon getting home, leaving your shoes outside, putting your clothes immediately in the washer, taking a shower, those type of things. And as Dr. Cagle said, certainly if you have someone at home or someone that you may visit who is elderly or does have other serious pre-existing medical conditions, then maybe take some extra time and quarantine yourselves from those folks.
Dr. Cagle, this is in kind of response to the protest. There is a curfew tonight. Of course, if you have a medical issue, you are allowed to be on the road to seek that medical help. And I know we've had some discussions about this before because people have stayed at home because of COVID-19 and not sought medical help when necessary.
Yeah, so we want people to seek help when necessary. We have been very careful to make certain that the emergency department that Dr. Steinle oversees is a very safe place to seek care. So whether it's calling 911 if it's an urgent emergent situation, or whether it's going to the emergency room directly, we want people to get the care that they need. We have a special hospital just for the COVID patients. But we want people to get the care that they need, and we've made it a very safe way to get care. We're taking precautions with all of our employees wearing masks. And as we've said, we want people to be in masks if they can at all do that, because we believe that social distancing is the way that we're going to be able to defeat this virus.
And speaking of which, I mean, we had a few hundred people in Greensboro, also in High Point, Winston-Salem, but in New York, it was thousands of people protesting. And New York, of course, known for COVID-19. When you see those kinds of images, I'm sure it's hard not to think that there will be another rash of cases again after this. So people are asking, is the second wave coming because of this?
Well, you know, one of the things we do here is every day we look at how many cases we have and we model what we think is coming. And we look at the crowds that we have locally across the state and then in the nation. And I do think that one of the risks that we are taking by gathering in these big crowds is creating a second wave of infections. So I think that is a possibility that we have to consider and prepare for.
All right. We are going to continue our discussions about COVID-19, how the hospital is helping folks who are coming into the hospital. We're also taking your text questions. All of that is coming up in the next 15 minutes. We'll be right back.